We're going to show you guys how to do controls on the iStat today. If you ever need to do the controls to make sure you reset your number, you have to do controls a couple times a year just to make sure that you are staying current in the system, otherwise it kicks you out. So turn it on, you're going to have your lab results, iStat cartridge, hit menu, there's going to be a quality test, hit 3, and you're going to want to run controls. You're going to put your number in twice. Then you're going to do, I just always pick the 1. And now you're going to do your level. So there's level 1, 2, and 3. What they'll give you are little ampules that I've already put the tops off of. You'll need 1 and 3 controls. So start with 1. Get your little iStat cartridges. So you'll scan the ampule first. Then you scan your little cartridge. I like to take a little filter straw just because it's easier to suck it up and not cut yourself and or get it everywhere. Suck a little bit of it up. And you're going to fill your cartridge just like you would with a blood sample. It just looks kind of like Windex. So fill it up, close it, stick it in the bottom. It'll say cartridge locked. You hear it making a noise. And then it will take 2 minutes to run this, and you'll actually get lab results from this. And the level 1 should have some low stuff, like you'll have somebody that's like their pH is like 7.2, the sodium will be low, all of the results will be on the low side for that one. So we'll have to wait, let that run through.
A few minutes later.
Results from level 1, as you can see, we've got a low pH, we've got a high PCO2, PO2 is normal, your base deficit's negative something. Scroll over, we got a low sodium, low potassium, low calcium, glucose is high, and a low hemoglobin. So that is level 1. So next, we're going to enter through here, hit the menu button, so enter through the fields. Hitting 1 for test options, we're going to go back to quality test, which is 3, controls, which is 1, again putting in your number. Number 1 again, and now this time we're going to do level 3. So same thing again, we're going to scan our little ampule without cutting ourselves. We're going to scan our cartridge. And same thing, we're going to draw up a little bit of the solution. And we're going to squirt it in the cartridge without getting it everywhere. Just till it's full. Close it. Can only go in one way, so it's nurse proof. And same thing. So now we got to wait 2 minutes for this one.
A few minutes later.
Okay, so here's our level 3. As you can see, our pH is now high. PCO2 is now low. So just kind of the inverse of what we had with the last one. It doesn't really matter so much what the results are, just that you have them. So page through, so we're done with that one. And now, we can do an actual test on an actual person. So what I'll do is I'll hit 2 for iStat cartridge. Put in my number twice. Now patient, gonna make up a number here. Oh, 3, 4, 5, 6, 7, 8, 9. Let's say 10. 4, 5, 6, 7, 8, 9, 10. So if you have an actual patient, you can actually scan their badge if you're doing one. If you're going to do one on yourself and or one of your cohorts, then you just do the zeros. All right, so what we did with this one, there's a couple ways you can get blood for an iStat, right? You can get an arterial, either by a stick or an art line that you can suck off of. You can get a venous sample. In the adult world, we tend to use either, if they have a central line, that works. If they have a peripheral line, that works. And you can also do your little pipettes too, where you just use a like you're going to get a blood sugar, poke their finger and just try to get enough blood so you can fill your little sample. I don't tend to use these just because I don't have much success with them. Over the last year, I found them a little bit harder to use than just sucking off of a good IV. Just remember, when you're sucking off of an IV or a central line, you need to waste some. So with a peripheral IV, usually 5 cc's is way more than enough. With a central line, like a PICC line, you'll probably want to take off about 10 cc's. So I will flush it first, real good, and then I will waste the 10 cc's off of a PICC line, and then I'll pull whatever I need, which for this is maybe a cc at most. So for our purposes, what I'll do is I'll flush my little peripheral line here. May need more hands here, but you hold it. There we go. So I'll give her a flush first. There we go. Pull off my waist.
Obviously, we'd be wearing gloves.
Yeah. Okay, and then about a cc is all you're really going to need. All right. So I've already scanned my cartridge. I've already scanned my patient. So it's going to identify cartridge first. And I know a lot of you guys out there haven't really run iStats before. We're going to have to answer a bunch of questions here in a second. So it'll take a minute to identify this, so you could be doing other things. A lot of times I like to kind of, especially when we get them in the back of the ambulance or before we leave bedside, get this going and then start doing other things. Like get my assessment going, all that other stuff, because then this stuff right here will pop up. And so the first question is going to ask is site. So for me, this was a venous line. So if you did an arterial line, you could do that. If you had you actually did a poke in the radial or the brachial or a femoral artery, then pick that. For me, I'm gonna just pick that it was number 3. That doesn't really matter. Sample, so it's venous. Allen's test, if you did an Allen's test, you could do that here. There is an NA. Number of sticks, just say 1. This is going to ask what they're on. So for me, so if I was on a vent, if I was on CPAP, BiPAP, non-rebreather, nasal cannula, high flow, yada, yada, yada. I was on room air when I took this, room air with a mask on. My O2 sat before, we'll just say it was 99. My O2 sat after was 99. Coronary pulmonary bypass, so CPB, if you have an ECMO patient, you really should be saying yes to this. And I think this is going to be more towards the nurses than our medics. But when our medics are running these with us, when we've got these ECMO patients, if you're on an ECMO, it is a form of coronary bypass. So for me, of course, the answer is no. Temperature of the patient would be pertinent. If they were a hypothermia patient, you would want to put their temperature in here. If you have a normal thermic patient, you can put it in there, but it doesn't affect, a normal thermia patient isn't going to affect your lab values. And again, 2 minutes we're going to have to wait, so we have about 30 seconds left on here. And then we will see how healthy I am. Almost there. Perfect. So, the PO2 is going to be low. That's going to be expected on a venous blood draw. So you're not going to get a good idea of what your PO2 is. Theoretically, their PO2 should be low. If you have somebody whose PO2 is high on a venous, you may want to question, was that a venous draw or did I get an artery? Or B, are they their oxygen level is so high that you're getting a PO2 of 120, their arterial PO2 is probably greater than 300. So I'm 735, 57, because I'm talking, that's my mass, is making me hypercarbic, not really, it's a joke. My bicarb's fine. Sodium's decent, potassium's decent, calcium, all of that stuff is good, right? One big thing is when you draw off of a line, you may get some sort of a mixed solution even with a waste, to where if you're all of a sudden you're seeing your potassium is like super high or super low, you may want to think, did I do something with drawing this sample that I got it so mixed up that my potassium's super low, or that I drew up some potassium containing solution that it's super high, that maybe my other numbers aren't really accurate. So for me, it seems fairly decent. You can't complain too much about that, given that it's a venous sample. But that's how you run a gas.